Welcome back. Time now to bring in Hartford Hospital ophthalmologist Solinsky with Hartford Hospital's Eye Surgery Center. Thank you so much for joining us this afternoon.
Thank you so much for having me.
Well, Dr. Solinsky, we're still learning so much about COVID-19 and what exactly its effects are. Do we know if it can affect the eyes?
It can produce a viral conjunctivitis in the eye. It's very, very rare, and if it occurs, it's very mild as well. Our office has been seeing patients on routine emergent basis since March, and we have not seen any COVID-19 conjunctivitis.
What if someone were to have it? What were some of the symptoms they look for? Is it similar to normal conjunctivitis we might get?
It would, red, itchy eye, a little bit of discharge could come out as well. Pretty much the same.
Okay, and COVID-19 has affected a lot of the ways we do normal things in our everyday lives. And for you, well, that's the practice of ophthalmology and surgery. How has that maybe shifted or changed in the past few months?
Well, safety, safety, safety is what it's all about. In March, the American Academy of Ophthalmology told the doctors to cease doing routine exams in the office and also not do any elective cataract surgery. So we've been doing emergent care and urgent care for our patients that need it on a day-to-day basis, flashes and floaters, people who need injections for macular degeneration and glaucoma. Retinal detachment surgeries have been done, as well as emergency glaucoma surgeries as well. But now we're ramping up for more elective procedures such as cataract surgery and also seeing more routine patients in the office.
And like you just mentioned, you are kind of getting back to normal. To those patients who might be fearful of coming in for surgery, is there a risk for maybe prolonging that cataract surgery?
Well, very, very low risk for people to be exposed to COVID-19 when they have the surgery. Basically, over the last 3 months, there's about 500,000 patients nationwide that have been postponing their cataract surgery. In our area, there's probably a few thousand at the surgery center in Newington. And we have to treat those patients because they had cataract surgery that was supposed to be done in February and March and April, and we don't want to keep putting that off because they had good reason to do it, such as decreased vision, they wouldn't be able to drive, they wouldn't be able to read. So those should be done, and they're being done in a very safe fashion. At the surgery center, all the patients get screened so that they're COVID-19, and they should be in quarantine for several days before they come to the surgery center. When they're at the surgery center, they're in the parking lot first. They call up, and we make sure that they're available immediately to be whisked right into the preoperative area, bypassing the waiting room. There's screening done. There's temperature checks on all of the patients and all of the staff that's coming in as well. The doctors and the nurses and the patients all have masks on. The doctors have N95 masks on. And about a week after the surgery, we call all those patients to make sure they didn't come down with COVID, so that if, God forbid, somebody did, we have a tracer mechanism in place.
Wow, sounds like you have a whole lot more than just a tracer method. I'm sure all of your patients are grateful for all of your safety procedures in place. Dr. Solinsky, thanks so much for joining us.
Okay, thank you for having me. Bye.